Ever pondered over why we experience nausea and vomiting under certain circumstances? Today, we delve into the mystery and explore the reasons behind these common yet perplexing phenomena. Food poisoning, for instance, is an ailment that strikes when you ingest something contaminated. Be it bacteria, viruses, or parasites, these tiny troublemakers can induce symptoms like nausea, vomiting, diarrhea, and abdominal pain. These symptoms typically surface within hours of consuming the tainted food, but sometimes they can take days or even weeks to appear. Now, if you're thinking a little stomach upset is no big deal, remember that in severe cases, food poisoning can be life-threatening. Another culprit is viral gastroenteritis, colloquially known as the stomach flu. This illness is birthed by a virus that infiltrates the stomach and intestines. Similar to food poisoning, the symptoms include nausea, vomiting, diarrhea, and abdominal pain. The onset of these symptoms usually occurs within 12 to 72 hours of exposure to the virus and can linger for several days. This little bugger is highly contagious and can spread its misery through contaminated food, water, or surfaces. Then we have migraines, a type of headache that can be so severe it feels like a tiny jackhammer is pounding away inside your head. Migraines often come with a side of vomiting and nausea, making the experience even more miserable. These headaches can be triggered by stress, lack of sleep, certain foods, and hormonal changes, among other things. Another type of headache that can cause nausea and vomiting is the cluster headache. These severe headaches occur in clusters and are thought to be caused by a dysfunction of the hypothalamus, a region of the brain that controls various functions. Motion sickness is another condition that can cause nausea and vomiting. This typically occurs when you're in motion, such as in a car, boat, or airplane. The conflicting signals sent to the brain by your eyes, inner ears, and body can result in nausea, vomiting, dizziness, and sweating. Pregnant women may also experience nausea and vomiting, commonly known as morning sickness. This typically kicks in during the first trimester and peaks around 6 to 8 weeks, often resolving by the 14th week. Certain medications can also cause nausea and vomiting as side effects. Chemotherapy drugs, antibiotics, and pain medications are common culprits. Taking these medications with food, avoiding alcohol, and staying hydrated can help manage these side effects. Stress, the ubiquitous villain of the 21st century, can also trigger nausea and vomiting. The release of hormones under stress can wreak havoc on the digestive system, but finding healthy ways to manage stress can help keep these symptoms at bay. In conclusion, there are various reasons why we experience nausea and vomiting, from food poisoning and stomach flu to migraines and motion sickness. It's important to understand the cause of these symptoms and seek medical advice if they persist. Remember, self-care and professional help are key to feeling better. Until next time, stay healthy.